Hello, my name is Dr. Johnathon Miller. I'm a third-year resident physician with Wright University in the Department of Psychiatry.
I'm Dr. Lisa Carter. I'm a second-year internal medicine resident through Wright State University.
Today, we want to discuss barriers and misconceptions to COVID-19 vaccination.
As we consider barriers and misconceptions to COVID-19 vaccination, it's often helpful to understand where these barriers and misconceptions come from. On the current slide, I have included a timeline that highlights the more well-known occurrences of inequity in this country. Historically, inequity in the US has been institutionalized, meaning government supported, as well as based upon racial, gender, sexual orientation, and socioeconomic status. This timeline begins in 1748, where by law and under penalty of death, slaves were prohibited to practice medical care. We continue to 1846, where female slaves, without their consent and without the use of anesthesia, were operated on to develop gynecological and surgical techniques. In 1932, the infamous Tuskegee experiments occurred, where African American men who enrolled to study syphilis were denied adequate treatment. In the 1960s, Latino and Native American women were disproportionately targeted to be placed on birth control or to undertake non-reversible fertility treatments without giving their consent. Most recently, in 2015, the residents of Flint, Michigan, a predominantly African American community, were ensured by state and local government that water that contained high amounts of lead was safe to drink. Ultimately, the result of these systems is a lack of trust in government and the medical system. Likewise, the conceptions that were established in the community because of these events are still present today and often limit whole communities' access to care. Concerning COVID-19 vaccination, current misconceptions are based on these past community experiences that were highlighted in the timeline, most notably the concerns for poor representation. No one that looked like me developed the vaccines. No one that looked like me were in the vaccine trials. Why should I trust it? Substandard care. Why should I trust you? You people have lied to me before. I can take care of myself. Unethical testing. Are the vaccines really effective? They were created so fast. How do I know they even work? Sterilization. Are the vaccines going to make me sterile or infertile? Are they going to kill my baby? Induced illness. Are the vaccines going to give me COVID-19? Are they going to make me sick? The percentage of Americans who have already been vaccinated or intend to get vaccinated has been increasing over the last few months. About 55% of Black Americans have been or intend to get vaccinated, which is up 14% since February. This is compared to 61% of Hispanic individuals and 64% of white individuals. While this gap between different groups has narrowed, it is important that we continue to work to close that gap. The data has been clear for a long while now that people of color have suffered disproportionately at the hands of COVID. Thus, while as clinicians, we strive to improve the health and safety of all of our patients, it is especially important that we continue to work on improving outcomes for some of our most vulnerable patients. To reach populations that are statistically below average, concerning consent to vaccinate, it's important to offer additional resources and effectively communicate the availability of these additional resources. The picture located in the bottom corner of the screen is one of my favorites. Equity and equality are often confused. To achieve an effective response in our patients and our community, and to create an equal overall medical experience, allocation of resources is needed to go to those with the most need.
So how do we overcome these communication barriers and misconceptions with patients? As a medical student, I was introduced to a communication technique called NURSE. It's a technique that I use in every clinical encounter. The technique consists of naming the emotion or feeling. It seems you're unsure of getting the COVID-19 vaccine. Understanding the core message. If I understand you correctly, you're unsure getting the COVID-19 vaccine because you don't feel they are safe. Why do you feel that? Demonstrating respect and providing reassurance at the right time. I think if I had experience with things you did, I would feel the same way. Many people are feeling unsure about vaccination at this time. Notably, it's important to validate how the patient is feeling, as well as normalize their experience. Providing support. Thank you for your honesty. I imagine feeling the way you do, it will be difficult to go forward with vaccination. Is it okay if we discuss some resources that are available that may address your concerns with vaccination? In further exploration, I'm curious, what are the concerns or questions you may have about the COVID-19 vaccines? There are many barriers and misconceptions to COVID-19 vaccination. It's impossible to know all of them. However, by expressing empathy and taking a non-judgmental approach, it's possible to encourage and develop open communication with patients about their concerns. With establishment of open communication, misconceptions can be reconciled, and patients can be directed to the resources they need. The state of Ohio has already made allocations of resources to address concerns such as historical trauma, changing immigration status, or lack of transportation, to name just a few. As healthcare providers, it's our job to bridge the communication gap between patients and our medical system.
Before we conclude, I would just like to add a few more items. As already noted, developing a rapport and open line of communication is vital. However, we believe it is also crucial to give patients the resources to obtain accurate information. In our digital age, it can be increasingly difficult to distinguish trustworthy sites from questionable ones. Thus, providing our patients with a list of reputable sites can help empower them to verify information received from their healthcare provider and inform their decisions on whether to receive vaccination. Lastly, this presentation has focused on communicating with patients. However, this information can also be applied to discussing the vaccine with family and close friends. Your family and friends who express hesitancy about the vaccine want their fears and concerns to be heard, just like your patients do. Letting them express their doubts in a non-judgmental environment is crucial. As a healthcare provider, you have the power to address their concerns and to empower them with reputable tools to do their own research. However, your relationship with that person can also be of huge value. Of course, this may not be applicable to every situation, but in general, having someone you know and trust try to alleviate your fears can be extremely powerful. My own family asked me to do a Q&A session, which went pretty well. I did my best to listen and respond to their fears, assure them that the vaccine is safe, and I reiterated that I myself have been vaccinated. By having that personal relationship, you may be more effective in convincing them to get vaccinated than their own PCP. For resources that were discussed in this segment, as well as resources to provide to your patients, please see the resource toolkit. For any further correspondence, please do not hesitate to contact us at the email addresses provided. Thank you very much.